Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each week, we deliver informative health and wellness topics you want to know about, so be sure to subscribe to us on your favorite podcast channel. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session, streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPACares. Now here's your host, Chief Operating Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm your host, Kyle Longton, and today we've got just an overview episode for the month of May. So it's just me, no special guests. We're working on some for future episodes throughout this month. But before I get to today's topic, I just wanted to highlight a few upcoming events that we have. First, for those of you who are retirees from the Department of State, Foreign Service, and Civil Service, this Friday, May 5th, is Foreign Affairs Day, the homecoming at the Department of State. The program will be hybrid this year with an in-person component at the department, and also the program will be streamed live. We are proud through our foundation, the Senior Living Foundation, to be one of the sponsors of the day, and our AFSPA CEO, Paula Jacob, who also serves as the Executive Director of the Foundation, will be speaking at the event about the work of the Foundation. So look for that. It will be streaming online, as I said, on May 5th, and it should be available on the Department of State's YouTube page shortly thereafter for on-demand viewing. I'll also point everybody to afspa.org/events. That is the definitive list of upcoming events that we have. And right now, we're highlighting some upcoming financial wellness webinars on May 10th, 17th, and the 24th. Look for those and go ahead and sign up. They're offered at various times throughout the day to try to meet your schedule wherever you are in the world. And finally, I'll also refer you to the May CEO message sent to members of AFSPA from CEO Paula Jacob, which includes a bit more information about some of the topics I'll be discussing today and more. Those come out monthly, and if you're not getting them, please contact outreach@afspa.org to make sure you're on the list. Now to our episode today. May, and every month, but May is our focus today, has a lot of different health themes that we often choose from for some of our various events, including podcasts, blog posts, and more. And today I just want to highlight a few of those. So May is Mental Health Awareness Month, High Blood Pressure Awareness Month, Better Speech and Hearing Month, and it also includes Women's Health Week. So today, AFSPA talks about all of those, and generally, AFSPA talks about the month of May. Let's start with Mental Health Awareness Month. 2 years ago, this podcast launched in the month of May, and our very first episode, one of our longest and a great episode, began with a discussion of mental health. We were about a year into the COVID-19 pandemic, and we talked a lot about how that was affecting people, but also about mental health prior to the pandemic, that the country was already in a crisis state. And of course, the pandemic didn't do much to help that. So that is still a relevant episode. We are working on some additional episodes this month about mental health, so I hope to be able to offer those sometime soon. In the meantime, I want to refer Foreign Service Benefit Plan members to a number of programs that we offer to help them support their mental health. Many of these we've highlighted in past episodes or even recently on AFSPA Live, but I'll take just a minute to mention some of them. We offer, and these, unless I say otherwise, are available at no cost to members. We offer a program called My Strength that goes back to the very first episode we recorded for the podcast. And this is an online self-directed support program for mental health. It's available worldwide to members aged 13 and older. And this allows you to go through daily affirmations and, as I said, self-directed programs for common conditions like depression, anxiety, even substance use disorder. I encourage you, if that's of interest, take a look at that. It is private. We get questions a lot of times, particularly about mental health, that this information, if they use it, will people's employer know? No, we cannot share information with your employer. It does not get back to them. This is a program meant to support you wherever you are in your life's journey, and also wherever you are in the world, because we understand that access to care is not the same everywhere. Check out My Strength. Also, for those in the United States, If you're going through sort of a major life transition, it could be the loss of a loved one, could be the diagnosis for yourself or a loved one of a chronic or terminal illness. Could also be something that a lot of us think is joyful, like the birth of a child, but or adoption of a child, something like that. These can be disruptive events in our lives, and they can take a strain, put a strain, I should say, on our mental health. We offer a program specifically for that called Able To. And Able To is available only to members located in the United States. And it's an 8-week program that allows you to work with a health coach, a mental health coach, along with a counselor to work through this change and figure out ways to manage any feelings that arise around that and incorporate those changes into your life. So if that might apply to you, check that out, please. Also, for members in the United States, we offer a partnership, I should say, with Brightline Health. Now, this does have a cost sharing component. I'll get to that in just a moment. But Brightline Health is specifically focused on providing coaching and care at various levels to parents of children under 18, as well as to children themselves. This is a telemedicine program, and Brightline is considered in-network, so you have the in-network cost sharing, but they do offer direct coaching and care to children as well as to parents. And there's another component to that called Connect, where you can go on and look at their library of resources and so forth. So you can find more information about that at hellobrightline.com/FSBP, and we'll put that link in the show notes. But I encourage you, it can be difficult to find a mental health provider, particularly for children, particularly one who is in network, to check that out. We've seen fantastic engagement from members since we launched this partnership last summer. Also, in the virtual visit space, we offer options for our members in the United States and overseas through a partnership with Teladoc. When in the United States, you can access Teladoc services for general medicine, dermatology, nutrition, and relevant to today, mental health. This is available at no cost to you, covered 100%, and you can engage with licensed counselors, with psychologists, and with psychiatrists in a secure virtual environment through the Teladoc app. The Teladoc services are available specifically to members located in the United States. If you're outside the United States, we offer a program also through Teladoc International that we call V-Health. This offers general medicine services, but also a mental health component to members outside the United States. I'll put the links in the show notes so you can find out more about that. But V-Health, I will say we're seeing increasing engagement, particularly in the mental health area. I will note that it is we see about 2-to-1 engagement, women over men, and I think it's great that people are engaging in this. I think men, we've got to get over our stigma about seeking mental health treatment and support when we need it. So please check that out again through a secure online environment. More information in the show notes. Also, for our members overseas, we have had a partnership with a group called the Truman Group for a number of years, and they've supported us for a number of podcasts, as has Teladoc and Brightline. If you're an expat, you're living overseas, you need mental health care, and this could be people of all ages. We've done some work with them for various needs, particularly for teens. Truman Group does offer this. They specialize in expat care. Check out they're probably already known to you if you're outside the United States and have this need, but you can find out more about them. I'll again post a link in the show notes, but we do treat them as an in-network provider. There are other ways you can access care from any provider in the world. We do have in-network and out-of-network benefits. A reminder that all providers outside the United States are considered in-network, so they get that higher coverage. But please, if you're looking for mental health support, find it either through one of the programs that I've mentioned or from a local provider. So also wanted to highlight that it is Blood Pressure Awareness Month, and this is an increasingly common health condition. And it is something that there are a lot of options for management. There are programs out there that engage and support people through mindfulness and meditation and things like that. And most people on high blood pressure who've been diagnosed with high blood pressure or hypertension are on some sort of daily medication to help keep it under control. Now, unfortunately, too often we see people are taking this medication, they see, surprise, their blood pressure comes under control. But unfortunately, some people think, okay, I don't need the medication anymore. In many cases, the blood pressure is down because you're taking the medication. So don't stop. Certainly don't stop until you've talked with your doctor about your options. Just keep that in mind. And I'll highlight one program that we have for a remote hypertension monitoring program that we offer through Livongo. This is free to members of the Foreign Service Benefit Plan. It offers you a Bluetooth connected smart blood pressure cuff that you can use. And beyond that, it also comes with coaching. There is coaching available through this program. It can be very helpful to you in terms of strategies to manage blood pressure and just keeping an eye on things. There are also programs available through our lifestyle and condition coaching program, or LCC. And you can engage in those programs. And I'll again post links in the show notes for both Livongo and the LCC program. But please take your medication, have conversations about your doctor before you make changes, and look for support. There are a lot of ways to gain support as you seek to manage this and other conditions. I'm going to move on to a personal passion of mine, which is Better Speech and Hearing Month. If you've listened to the podcast devotedly since the very beginning, you will know that I am 10 years into wearing hearing aids. I actually got my first pair of hearing aids prior to my first overseas travel for AFSPA. I noticed I was having trouble, and I wanted to make sure I could hear member questions when I was traveling at that time through Korea. So glad I did. It was life-changing to get those hearing aids. I'm now on my fourth pair. And if you've heard an audiologist or anybody talk about this before and say, oh, well, the technology improves and improves, they're not kidding. I had to recently wear an older pair when I was having trouble with my third pair before I got the fourth. I wore an older pair and it was no comparison. It was the newer technology is so incredible, and adjusts automatically. And the settings are there, and they make a difference when you really need them, but oftentimes you don't even need to make changes because they are so technologically advanced. So I share that because I know there are a lot of people out there who are maybe on the fence about getting hearing aids or not sure they need it. Please do it. I got my first pair at age 27. So please don't think that you are too young to get a pair. If you need it, get it. And see how it makes a difference in your life. AFSPA is here to help you because oftentimes one of the barriers to hearing aids can be the cost. We offer a discount program in partnership with True Hearing. You can find details about that at afspa.org/AIP for ancillary insurance programs. Click on Discount Care Programs. And True Hearing, going through True Hearing, they'll make the first appointment for you with an audiologist in your area. And then you'll get the discount when you purchase the hearing aids, which can be sometimes around 40% of the total cost. You can make hearing aids very accessible. If you're an FSBP member, we've got a benefit that makes them even more accessible. You have up to $4,000 every 3 years for the purchase of new or replacement devices. So make use of that, and let us know if you have any questions. We are working on an updated podcast about hearing aids, particularly to talk about the over-the-counter hearing aids, which sometimes may be amplifiers more than hearing aids, but we'll get to that as soon as we can, working on True Hearing to bring us more information about that. Finally, a word about Women's Health Week, which begins on May 10th. It always takes place around Mother's Day. I'll note just from experiences in my own life that women are often the caretakers in their families. I've seen this with my grandmothers, with my mother, with my own spouse. Oftentimes it is women in the family who are dedicating time to caring for partners, children, parents, friends, and more. It often can happen, though, that those people who are caretakers of others don't necessarily have time or make the necessary time for their own health. So this is a friendly reminder for everyone, but this month, especially women, to take the time to care for your own health needs. This means getting that preventive visit, getting that well women visit. FSBP covers preventive services, including cancer screenings, annual physicals, and more at 100% from in-network or overseas providers. I'll also note that a recent survey at the Department of State showed interest among employees in more support for people experiencing menopause and perimenopause. Services related to menopause are covered under FSBP, and we'll get some more information out to you in a blog later this month, so look for that on our website. We'll also try to promote more information about the support programs and services that are available for people experiencing symptoms of menopause and perimenopause. So please look for that information, not just this month, but over the course of the next year. And throughout this month, we will be bringing you more content through social media, our blogs, our website, and this podcast. Don't forget about AFSPA Live, our monthly live broadcast, but please note that it will be a week earlier this month. Instead of the last Thursday of the month, it's actually going to be on May 18th. It will still be at 11 a.m. and streamed on Facebook, LinkedIn, and YouTube. We'll be putting more information about that soon, so stay tuned. Thanks for joining me today. Stay healthy. Look for some Mayflowers. I know here in the DC area, we've had our fair share of April showers recently. So I hope that all of us will be experiencing some Mayflowers soon. And I hope you have a great month. Stay tuned for more information and stay well. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. The views and the opinions shared on this podcast by the host and guests are theirs alone and do not necessarily represent AFSPA or any of its partners. All information covered in this podcast is meant to be educational. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or the other products offered by AFSPA, the policy provisions will prevail. Thank you for listening, and be sure to subscribe to AFSPA Talks to catch our next episode. Please rate and review us on your favorite podcast app and share feedback with us on Facebook, Instagram, or LinkedIn. Search for AFSPA Cares. We'll talk again soon.
Thanks for joining us this week on AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live on our YouTube channel at youtube.com/AFSPACares at 11 a.m. Eastern Time to answer your questions. Thanks for listening.